Good morning, everyone. I'm Mayor Muriel Bowser. I am joined today by members of my cabinet and emergency response team. We are also joined by Council Chairman Phil Mendelson. The chairman will provide his updates and take questions, and then we will go through today's situational update. We are focusing today on a new tool available to help DC in its contact tracing efforts. So now let me turn it over to Chairman Mendelson for his comments in question period. Mr. Chairman.
Thank you, Mayor Bowser. Good morning. Just as a reminder, we've been having these joint press conferences on the day before legislative meetings since the beginning of the pandemic because this is easier on everyone if we just have this one press conference on that day. So I am going to talk a little bit about what is happening before the council tomorrow and then take questions if there are any, and then turn it back to the mayor. And again, thank you for doing this jointly. The council has shifted its meeting time from 10 o'clock on Tuesdays till noon, although we've resurrected the breakfast that we do in the morning, although it is breakfast without breakfast, because it's done virtually. And that is accessible to the public. I believe it's done through the Zoom platform, and that will be, I believe, at 9 o'clock tomorrow morning. So the meeting will begin at noon with a Committee of the Whole meeting, where there are, I believe, 15 bills being marked up by the Committee of the Whole, and then another 9 or 10 that are being reported out of other committees. Of the bills that probably get the most attention is the Racial Equity Achieves Change. That's a slight renaming of the bill commonly called the REACH Act. Assuming that everything is worked out, it will be on the agenda tomorrow. Well, it is on the agenda and will stay on the agenda. I'm still working with Councilmember McDuffie on some issues within the bill. Also, there is a bill being marked up in the Committee of the Whole concerning dyslexia and other reading difficulties that sets forth some new policies with regard to public education and ensuring that kids are tested to see if they have reading disorders, that there is the proper training for teachers and others in schools to recognize when there might be a reading disorder so that we can address what could be as many as 20% of our students who have a reading disorder, which holds them back in their ability to learn to read. There is another education-related bill being marked up in the Committee of the Whole. Its title is Expanding Equitable Access to Great Schools Act. What it's about is adding 2 preferences in the lottery selection for schools. This is where parents go onto the My School lottery to select what school they want their child to attend the following year. And the preferences being added are an at-risk preference. If a charter school, and I have to emphasize, if a charter school wants to have an at-risk preference, then this bill authorizes that. Without our doing this legislatively, a charter school could not do that. And also requires that the charter school has to continue with that at-risk preference for a minimum of, I believe it is 3 or 5 years. The other preference is a child-parent or parent-child preference, because there's one charter school which it's an important feature of that school is that parents and their children can attend together the school. So this is being added as a preference. The sense of the council for renaming Woodrow Wilson High School is back on the agenda for tomorrow. There are 2 nominations the mayor made to the Board of Trustees for the University of the District of Columbia, reappointing Christopher Bell, who's also the chair, and also newly appointing Mignon Clyburn as a member, and I expect that those will go through without any controversy. One other bill that's being marked up, which I think is of some interest, it's a street naming, it's a ceremonial naming. I ordinarily wouldn't highlight this, but it's to name one block of 14th Place Northeast after Gail Cobb, who was the first African-American woman police officer to be murdered in the line of duty in the United States. She was shot and killed in connection with a bank robbery, an attempted bank robbery in Foggy Bottom in 1974. Several bills are being proposed from other committees. Three are concern the Alcoholic Beverage Regulation Administration, including authorizing expanded hours. And there is a bill that came out of the Committee on Health called Minor Consent for Vaccinations Amendment Act. I don't have the details in front of me, but I know there's a little bit of controversy in that there are folks who do not support vaccinations and therefore do not want us to move forward with the bill. I think that vaccinations are in the public health, and this bill's gone through the hearing and the committee markup process, and I expect the council will go forward with it. There will be an additional legislative meeting following Committee of the Whole, and looking at that agenda, much of it is covered by the Committee of the Whole. There is for final reading a bill called the Abatement and Condemnation of Nuisance Properties Amendment Act, which will strengthen the ability of the Attorney General to go into court for receivership with rental property, basically slum property, that has had serious violations, housing code violations for at least 30 days. The buildings that have been taken to court are buildings that have had chronic violations for a much longer period of time. And we're talking about violations that affect health, safety, and security of the tenants. And this bill is up for final reading and, as I said, will strengthen the hand of the Attorney General in court. And there are three emergency bills. Emergency bills, I know you all know this, but I'll just say this for the public that may be watching, are bills that can become effective as soon as approved by the council and signed by the mayor. They don't require congressional review, but they also are in effect for only 90 days. Typically, they're accompanied by a temporary bill that will last 225 days, but is submitted to Congress. One of them is the Clean Energy Omnibus Technical Amendment Emergency Act. It's just simply a reiteration, a repassage of a bill that's already been approved by the council. But because of the congressional review process, it's being resubmitted. A second is Common Interest Community Virtual Meeting Emergency Amendment Act, which will permit condominium and cooperative associations to have annual meetings virtually. We thought we had taken care of this when we did pandemic-related legislation earlier in the year, but that was for board meetings and not for the annual meetings. If you think about it, annual meetings are all the residents of a condominium or cooperative, and therefore, actually, social distancing becomes a bit more necessary and complicated. So this would authorize annual meetings to be virtual. And then the third bill is Unemployment Benefits Extension Emergency Act, which follows what is authorized in federal law for extending the period by which individuals are eligible for unemployment benefits, and that includes the Pandemic Unemployment Assistance Program. It's an extension of time consistent with that law, and I don't remember the exact number of weeks, but I expect that that will go through as well tomorrow without a controversy in the council. And that is tomorrow's legislative meeting. The next meeting after that will be November 10th, not the first Tuesday, because that's election day. And if there are any questions, I'm happy to take them. Yes, Sam?
I noticed you had a Black Lives Matter Plaza bill. The mayor designated this, I guess, probably back in June. What is this about?
It's the permanent version. So the council acted by emergency, and as I said a minute ago, emergencies expire after 90 days. And so this is the permanent authorization for the name. It's not more complicated than that.
Okay. And
except that there is a committee report that goes with it, so it explains to the public some of the reasoning behind it.
And then Gail Cobb, I remember when this happened, but at that time they said she was the first woman killed in the line of duty. You said African American. Was there
Yes.
another?
My understanding is that, in fact, with all of these namings, we do some research. Many people have said she was the first woman, female police officer murdered in the line of duty, and it turns out that's not correct. I mean, it's kind of really not comfortable to be talking about firsts in a situation like this, but so she wasn't the first, but she was the first African American woman. And maybe the first in Washington, D.C. of any race. MPD had not hired women until the early 1970s, I believe 1972. And to try to diversify its force, it lowered the height limit. Because her father had applied to be a police officer and had not been accepted because he was not tall enough. I think it was 5'8". So they lowered the height limit, and they were trying to encourage women, and she went through the academy, I believe, in 1973. It was murdered in 1974. Anything more, Sam?
Do you know who the first was?
No, you'd have to check.
Yeah, I guess that's how the story came out at the time. That's why.
I think if you check with the law enforcement memorial,
Yeah. Okay.
they will tell you. Yes, Mark.
Chairman, can you tell us the status of the council voting on the comprehensive plan? Will that happen by the end of the year, before the end of the year?
We have a hearing scheduled, I believe, 2 days, November 12th and 13th. Given the schedule, I think it's unlikely that we will be voting on it this year. We originally had expected it earlier, then we received it, and then you'll recall that our schedule was completely thrown out of whack with the public health emergency, so we got the budget. We asked for the budget to come later, and so we dealt with the budget through July.
Mayor Bowser, can I ask you about that? I mean, I believe, did you not want the comp plan voted on before the end of the year? Is that problematic that it might not happen this year?
Well, I certainly would like to talk to the chairman about it, and so we'll have some more conversations with him.
Chairman, you think
Yes.
it's possible it could happen before the end of the year?
I think that if we see that at the hearing that there's no controversy around it, that it might be possible. Remember, we have, after tomorrow, we have three more, maybe 4 legislative meetings. November 10th, November 17th, December 1st, December 15th.
And then if I could, I apologize, I didn't hear everything that you said about the unemployment insurance legislation. Can you expand or tell me exactly what that entails? I appreciate it, thank you.
Yes. The memo, I'm looking at the memo that Councilmember Silverman circulated. Typically, residents, this would be anywhere in any state, may receive up to 26 weeks of UI benefits, but then additional 26 weeks if authorized under the state law. And for the pandemic emergency unemployment compensation and pandemic unemployment assistance, an additional 13 weeks are authorized under federal law. And I believe that's what this bill is doing, is to just change our law so that it conforms with what the federal government authorizes.
So does it make it, because now, after 26 weeks, recipients have to reapply to get the extension. Is this legislation to make that extension automatic?
I don't think so. My understanding is that what the federal law requires is that the local law has to have an applicable, quote, high unemployment period, unquote, in our law. And that's what this is doing. And by doing that, then the DUES can go forward. I can't speak, as I'm sitting here, about whether an individual would need to do something in order to get that extension. I can't speak to that.
Thank you.
Yes, Mr. Rice.
On the comprehensive plan, are you aware of the letter that was sent to you by the zoning commission signed by
Yes.
Anthony Hood, asking for a vote as soon as possible because of cases that are in limbo, and to counteract, I think we've used adverse DC Court of Appeals decision, and a request from the committee winded up. It was an improper letter and should be withdrawn. What are your thoughts about that?
Well, I'm aware of the fact that while there have been some letters, such as the one you mentioned from the Zoning Commission, urging that we move quickly, there also have been letters, and you mentioned the Committee of 100 is one, that have demanded that we send the bill back to the mayor, which we're not going to do. So there are views on both sides of this. I'll just remind you that we received the bill in April. I believe it was something like April 23rd. And that might have been, we received it around then. We went into budget shortly after that. Our rules require that we have to have a public hearing on all bills, so we have to have a public hearing. Last 2 years ago on the framework, which is just the introductory chapter, if I remember correctly, there were about 150 witnesses for something like a 16 or 18-hour hearing. This bill is on more than just one chapter. It's on the remaining 24 chapters of the act or the comprehensive plan. So we've scheduled 2 days of hearings. We're not going to send the bill back. We're not going to do that.
Again, specifically to the letter from the zoning commission to you, do you have any thoughts on that letter?
We received it. I believe we received it in August.
I have another question on something else that's on the agenda.
Go for it.
Warehousing bill, that's to expand the authority of the mayor to condemn land for a warehouse on W Street Northeast,
Yes.
I believe. And there was talk there about it being a warehouse for records. As you know, I'm very interested in record storage, the archives, and so forth, which is now, there's been some personnel changes, which it's now former administrative public records, I can't remember the exact title, is no longer there. Are they related in any way, the archives, this warehouse, and storage of records?
No. At one time, they might have been, but they aren't. About maybe 3 years ago, the council identified that site on W as a possible site for the archives, which is why you're making that connection. But about 2 years ago, the mayor had announced that she thought UDC would be a good site, and so the planning has moved forward with UDC. So there's no longer a connection with W Street.
And the planning is still moving forward for UDC?
Yes, slowly, but yes. There's money in the capital budget, as I think you know.
And obviously the status of your advocacy group?
Much too slow, but I need to call the individuals to set that up, because that'll help us, the council, stay focused on this. Because it is important. I mean, what we're talking about, for those who don't know, is where do we keep our records, which in the moment are just paper, but at some point in the future, today's records are history. And where do we keep them? How do we keep them? And the current alley dwelling is not satisfactory.
Thank you.
Thank you. If there are no other questions, thank you, Madam Mayor.
Thank you, Mr. Chairman, and we appreciate all of the interest in the council's agenda, and we look forward to moving forward with you on the city's comprehensive plan, which is, as evidenced by some of the questions, very important to how we plan for all of the things that the city needs, including housing. So thank you for that. We're going to spend some time now talking about the city's response to COVID. And the health director, Dr. Nesbitt, is going to spend some time going into detail about how a new tool works, and then we'll take your questions. First, I just call your attention to our updated list of states that we want to ensure that DC residents are paying attention if they travel there for non-essential purposes and quarantine for 14 days when they come back. And you can see that list updated every 2 weeks at coronavirus.dc.gov, and the next update will be on November 1st. Also, on coronavirus.dc.gov, you will find our daily metrics that we post, and you can see how our goal is to get all of those boxes to turn to green. Our daily metric per 100,000 people is at 7.9 cases And we, again, want to see that under 5 cases, as we have seen in recent weeks. This morning, we report 25 new cases, and fortunately, no additional lives lost. We are also seeing the number of, in the community engagement bucket, the number of positive cases interviewed in the target amount of time. That number is also increasing, and we're happy about that, in addition to the number of people who are reporting their close contacts. So while that's moving in the right direction, it is not at a level that, that we have targeted as necessary to contain the virus. So for example, when we first started reporting these numbers, we reported that 67% of people were being interviewed within 3 days, and that has gone up to 74%. Further, we reported that only 35% of people were providing their close contacts, and now that's up to 46%, and so we want to keep that going. Starting this week, we have a new contact tracing tool. We talked about it several weeks ago. And it is an exposure notification tool developed by Apple and Google. And beginning this alert notice we're calling DCCAN, DCCAN, and beginning tomorrow, residents with an iPhone or Android smartphone can begin receiving push notifications inviting them to opt in to this exposure notification tool. This technology was created for the sole purpose of helping to stop the spread of COVID-19. The exposure notification system will be disabled once the pandemic reaches a point that no longer necessitates the use of this technology. Dr. Nesbitt has been really involved with working with these companies for a DC-specific product, and I'm going to turn it over to her to talk about how it works.
Thank you, Madam Mayor. And I just want to emphasize that this technology will work best if we have a high percentage of smartphone users, of iPhones and Android-enabled phones using the technology. So I'm going to share with you all how it works. As the Mayor mentioned, beginning tomorrow, Tuesday, October 20th, iPhone users will be able to turn on the COVID-19 exposure notifications in Washington, D.C., and iOS users will be able to opt in to exposure notifications through their settings without having to download an app. Once iPhone users turn on the COVID-19 exposure notifications through their settings, they will be prompted through the onboarding process, very similar to how you activate many other settings on your phone. If you go into your settings today, you will see exposure notifications. However, you won't be able to activate DC system until tomorrow. So you can go in and play around with it today, but it won't activate. It'll tell you that this system is not available in your region if you select DC, but tomorrow you will be able to opt in. For Android users, it is a little different. On Android, users will be prompted to opt in and install the DCCAN app from the Google Play Store. Here is an example of what it will look like when you go to download the app. And once you download and open the app, you will be prompted through the onboarding process. So here's how the system works. Once enabled, users' devices will regularly send out a beacon through the Bluetooth that includes a privacy-preserving random Bluetooth key. So I want you all to understand this is privacy preserving. It is not a GPS, a location system. This is just a signal through Bluetooth. Nearby phones will be listening for these beacons as well as broadcasting their own beacon if the system is enabled. Each phone will store the beacons it receives securely on the device. Once per day, the exposure notification system will download a list of keys belonging to people who will have tested positive for COVID-19 and reported their diagnosis through DCCAN. Each device will check the list of keys it has stored against the downloaded keys, and if there is a match, the user will be notified and advised on next steps from DC Health. This is what makes it specific to us here in the District of Columbia. If you want to learn more about the technology behind the system, we will post on coronavirus.dc.gov/DCCan more information to help you attach to the Google through its explanations on their blog. Now, here's a very practical example of how it will work. Here we have Alice and Bob, who don't know each other, but have a lengthy conversation sitting just a few feet apart. While they are chatting, their phones are exchanging anonymous identifier beacons. A few days later, Bob tests positive for COVID-19, and when the contact trace force reaches out, they ask whether he uses DCCan. He says yes, and they give him a code to enter into the system. With his consent, his phone will upload the last 14 days for his broadcast beacons to the cloud. Since their conversation, Alice has continued on with her life, going about her day, not knowing she was potentially exposed to a contagious person. But her phone is periodically downloading the keys of everyone in DC who has tested positive and reported it via DCCan. This system finds a match with Bob's anonymous identifier. When it finds that match, the alert pops up on Alice's phone, alerting her, letting her know she was recently exposed to a person who has tested positive for COVID-19. She also receives more information about next steps after completing a questionnaire. So here you can see an example of what it could look like if you get a notification that you were potentially exposed to COVID-19. You would get directions on what to do and also be able to see the date that you were likely exposed. Here's an example of what it will look like if you test positive for COVID-19 and then report it through DCCan. Again, you will need a code from a contact tracer in order to report that you tested positive. So this is all voluntary. You'll always be in control of your information, and the DC Contact Trace Force will be there to guide you through the process. In developing this tool, user privacy and data security was a top priority. The exposure notification system does not share location. It is not a GPS tracker. In addition, persons who test positive are not identified by the system to other users or to Apple or Google. Finally, DC residents can learn more about DCCan at coronavirus.dc.gov/DCCan. For obvious reasons, this tool will only be useful if we have widespread participation. So we need as many people as possible to opt in beginning tomorrow. And if you have an Android, download the DCCan app. So tell everybody you know, your family, your friends, your coworkers, social media networks to opt in, and ask them if they need help figuring it out, and we'll be sure to guide them through the process. And again, this is focused on the District of Columbia, or for residents of the District of Columbia or people who spend the majority of their time here. Thank you so much, Madam Mayor.
Thank you, Dr. Nesbitt. Okay, with that, we'll take your questions. The chairman remains if there are additional questions for him and for us. Any questions? Yes, Sam.
Dr. Nesbitt, you said if you're, say, sitting next to someone, say they don't have a DC phone, does it register? What happens?
So I want to understand what you mean by a DC phone.
So instead of 202, it's 717 or something.
Perfect, right. I wanted you to clarify that, because many of us don't have a 202 phone number, because when you move to another city, you don't necessarily change your phone number. It's not linked to to the area code of your phone number. It's based on whether or not you activate the region when you download the app. So when you go through the settings, for example, with the iPhone, you're allowed to select your region, which is essentially your state that you're in, and you select the District of Columbia. That turns on the app in our area, in the District of Columbia. So it will be identifying your, or sending your keys, rather, in the District of Columbia. And when you speak to a contact tracer in the District of Columbia, that contact tracer can give you a key for the District of Columbia. So the reason why the region is important is because it connects you with a local health authority when you have a positive test. So all of that information is based on where does data about positive tests go when you, as the person in control of your keys on your phone, releases that information to a local health authority. So you're always in control, but when you have a positive test, you can give that access to a local health authority. So it will work as long as you select your region as the District of Columbia.
What if you're visiting someplace, somebody here from LA?
So, perfect question. If California has turned it on in California and you are using it in California, you can select when you come to the District of Columbia, the District of Columbia. If they have not turned it on, let me say it differently. If they are in the Google Express, Apple Google Exposure Notification Express tool, you do not have to change when you move from one state to the other. And we will provide a list of states that are already interoperable with us. There are some states who are already interoperable. If they do not already have the tool, when you come to the District of Columbia, you can turn the tool on.
Mark?
So if I could just follow up on that, and I think what a lot of people are kind of focused on are Maryland and Virginia.
Yes.
So, and I think we've seen this rolled out, I think at least in Virginia, right? So are Maryland and Virginia participating in this? If I interact with somebody from Maryland or Virginia who's participating in this and test positive, would I get a notification?
Maryland does not yet have exposure notification tool. We are optimistic that they will adopt the tool that is interoperable. The current Virginia tool is an app that was developed specific for Virginia and is not yet interoperable.
So this app that you are using does not communicate with Virginia and Maryland. That seems like kind of a pretty big gap.
Maryland does not yet have a tool at all. We are optimistic that once they develop a tool, it will be interoperable. Virginia's tool that they currently have is not yet interoperable, but there are solutions that can be developed.
What does that mean?
Well, they have an app that was developed prior to this technology that is developed to allow all states who use the same tool to be interoperable. But there is a way that technology can be developed to make the different tools interoperable with each other.
Any other questions? Yes, sir.
Okay, so we have 39 states that are on the latest update on the quarantine list, and I'm just hoping you can put that in context for people who are starting to look toward November and make plans for potentially traveling for the holidays, Thanksgiving, and things like that.
I'm not sure how to answer that other than we still see, well, let me start by saying we still see about a quarter of our cases related to travel. And so we continue to emphasize to DC residents to avoid unnecessary travel. And we use this as a way to show you states where we see a high level of spread. We will have, as we do for Halloween, posted on coronavirus.dc.gov, additional guidance as well for the winter holidays, starting early with Thanksgiving and going through all of the time where people travel to see family. Some of it is travel related, but most of it is what do you do in small group settings, small group gatherings, where we see not only in our city but across the country virus transmission in small gatherings. Yes, sir.
I wanted to ask about Black Lives Matter Plaza. I haven't been down there the last couple of weeks, but there were barriers last time I was there. Are they still there, and is there any plan to remove them?
I'm not sure what barriers you're talking about.
These,
There's, if you're
I'm
talking
pretty-
about vehicle travel?
Yeah, that's right. There's no
Okay,
vehicle
so there
travel.
continues to be vehicle travel on Black Lives Matter Plaza, and we will continue to look for ways to have more vehicle travel.
So there is vehicle travel, but aren't there barriers still up?
There are barriers up.
So I guess I'm asking, when are the barriers coming down?
We don't have a plan to take barriers down. We have a plan to adjust so that we have more vehicles be able to travel through the plaza. We don't actually have a plan. We are contemplating how that can work.
But no plan, no date?
No,
in
sir.
mind as to
No.
when this would-
No. Anything else? Yes, sir.
What did you think about the protests in the past 10 days or so? One was outside of Councilmember Anita Bonds' house from the Sunrise Movement, and then one later at candidate Ed Lazier's house, led by people who said his backers were terrorizing a black woman. I'm hoping you guys give me your thoughts.
Well, I am a black woman, and I've been well, I don't want to talk about myself. Let me just say this, as I told Mark last week, that I don't think it is right to terrorize elected officials for doing their jobs, whether you agree with them or not. I don't think that's right.
Well, can I follow up on that? Because my question last week was about the Michigan governor and plots to kidnap the Michigan governor and the Virginia governor. Are you now equating what the Sunrise Movement is doing by having late night, early morning protests outside elected officials' homes or politicians' homes as terrorism?
No.
Okay, well, you just said that you don't think it's right to terrorize politicians.
Well, that was the question I was asked. Isn't that what you said?
That's the language they use.
That's the language you just used. Yes.
Is that how you think? Is that what you, when you looked out your window when they're outside your house, did you feel like you were, I know you don't want to make it about you, but do you think these people are terrorizing or just protesting? I mean, how would you characterize what the Sunrise Movement is doing outside politics?
Well, this is how I would characterize it. I don't think that they are representative of DC residents. Let me just give you an example. I actually listened to somebody on a bullhorn say, would we want to prioritize DC residents, or that wasn't the word he used, or I don't remember, natives or people of color to come up and speak. We want to prioritize that. Raise your hand. Nobody raised their hand. So what that suggested to me, or we have a lot of outside groups coming into DC, co-opting. First, it was the Black Lives Matter movement, or whatever the cause is of the day, and showing up at people's homes. I do not think it's right to bang on an elected officials or their neighbors' doors in the middle of the night. That is not right.
Can I go back to COVID?
Yes.
So in the material here for the app, it says it's part of the tools that you can use to help contain the virus. Has DC contained the, I don't know if this is for you or for the doctor, has DC contained the virus?
No.
Okay, because I asked that question because in your letter to the White House Chief of Staff on October 6th, you clearly say that that DC has contained the virus and that their Rose Garden event put that work into jeopardy. So I'm wondering why you would write to the White House indicating that you contained the virus.
We probably should have used a modifier like moderately.
I'm sorry?
We should have probably used a modifier that said moderately.
And then can I, staying with COVID, the testing sites are pretty much all outdoors. It's starting to get cold. Is there a plan for the testing sites once the temperatures really dip and weather, I mean, we see them close when it rains.
Rain is problematic.
Right, I get that.
Cold isn't.
So will they remain outside?
I don't think we have a plan right now to move them, Mark. If the team thinks that we need to make some adjustments because of cold weather, or, not just cold weather, but I would guess dangerously cold weather, then we'll come back to you. But that's not in our plan at this time.
And then I know that you put out guidance for Halloween.
Yes.
Can you or the doctor tell us, what is your biggest concern, or what is your biggest advice, if you wanted to get one message out to parents and trick-or-treaters and?
Well, we do have a list of guidance that's pretty specific. And Dr. Nesbitt may recall the elements better than I do, so let me turn to Dr. Nesbitt.
Sure. As the mayor has mentioned, our guidance provides details, and I'd prefer that people reference that guidance document where we have made suggestions for what are considered to be lower risk, moderate risk, and higher risk activities for people to participate in. The obvious is that traditional door-to-door trick-or-treating, where people go to neighborhoods and they're walking in opposite directions on streets, going up to doors of people who are not in their households and receiving handfuls of candy from people, would obviously be the highest risk activities that people would do this Halloween. And we're making that very clear to people. So we have made suggestions for some very much lower risk activities that individuals could do, as well as moderate risk activities. And lower risks are things that keep you in your household, mixing with only your household. And those moderate risk activities allow for some movement outside of the household, but still keeping the mixing with other households to a minimum. And so, you know, we've made it clear that you could possibly set bags at the driveway or the end of your porch if you have a walk-up, prepackaged, and that walking traffic on your street should only move in one direction. But those things would still have to be very highly organized and highly structured to reduce the risk and transmission of COVID. So if you haven't had the opportunity to review that guidance document and share that with your readers and viewers, we'd ask you to do that.
If I could just have one final on COVID. We've seen what's going on in Europe, and we see you've added 8 states to the list today. Dr. Nesbitt, what are your concerns, and what should we in DC expect as far as a second wave?
Well, you know, I think my concerns are very similar to those of us who are trained in public health and working on the response to this pandemic, is that people are, as some folks have said, kind of fatigued with COVID and the virus, but it is doesn't fatigue with us simply because we have fatigued with it, and perhaps are choosing to listen to some individuals who are not trained in public health or have the experience working in public health or dealing with pandemics, and that is, quite frankly, a recipe for disaster. We don't have the benefit of choosing to listen to the things that we find to be the most favorable to us or the advice that we like. We have to listen to the guidance and the advice that is going to save the most lives and create the balance of a response that does the least harm to us as a society overall. That being said, as we move into the fall and winter holidays and into the fall and winter season overall, there are some things that our communities and people have done that could confer some benefit. We know that people are being far more attentive to their hygiene, washing their hands far more than they were pre-COVID, being far more focused on, you know, wearing masks and keeping their distance. But we need people to recognize that what it means to keep distance, not dropping their guard when they're with friends and family, and keeping that same level of vigilance. So as we're seeing increases in the number of states, we have to be mindful of what that means for our traditional and typical plans during this period of time. And being mindful of how we can make some decisions, both as it relates to our social and emotional health, but also as it relates to our physical health. And I think if we are being very thoughtful and very decisive, we can keep and make balanced decisions in that regard.
Thank you.
Thank you.